How to proceed will depend on what's actually happening with Katie's cankles. So we need to establish whether it's water and fluid, and then we refer to that as lymphedema or edema, or if it's actually adipose tissue or fat distribution, and that's lipedema, and they're pretty separate issues.
Right. But they can both be treated if you want them to?
Not so much. Water is much easier to deal with, like, say, from when you've been on a flight, a long flight.
Get cankles on a plane.
So that is pretty straightforward. What's happening there, Mel, when you're on the plane for prolonged periods, normally the pump that operates in your lower leg to take fluid and blood back to the heart is just not being used because you're sat still for so long. And so you end up with extravasation, like pouring out of some of that fluid into the tissue.
Do I have to sit there and do little exercises and stuff?
There's loads of things you could do. Probably the best advice I can give you is to wear flight stockings. So compression hosiery is a really nice way of artificially pushing that water back in. Yeah. Exactly as you mentioned, you can do your musculoskeletal pump activities like they teach you on the plane. Elevation, if you have the luxury of
I'm going to insist on
supine on the plane, that will help. But when it's deposition of fat, like adipose tissue, that does happen, and unfortunately happens to women a lot more than men, and often starts around this middle-age period. We call that lipedema. It's not fully understood why. It's believed that it's to do with multiple things like hormone changes, inflammation in the fat, but that one is a bit harder to treat. Some things that have been tried have been massage, compression hosiery, low inflammatory diet to try and prevent the inflammation in the fat, and also there are some surgical techniques and some forms of liposuction for the lower limb which can sometimes be used, but that one's harder to treat.